Welcome to our first Uganda Symposium, our distinguished guests, colleagues, and friends. We are happy to have you here. And our theme for today, discussing innovation and the journey to excellency, with innovation being our spark and our excellency being basically a representation of the discipline of our teams to do it over and over again until we have reached a point where we are comfortable to reflect on it through our various medical disciplinary teams, interrogate it through our RCAs and our CAPAs, to the point today that we are able now to share it with all of you who are here with us.
Every year, tens of thousands of patients travel from East Africa to seek medical treatment outside, not by choice, but by circumstance. Today, that is the story that we want to change.
This is about sharing. And when you share, you become visible. It improves confidence in what you're doing. It inspires as well, but also most importantly, improves the way we look after patients. And that's the purpose. And in this era of AI feeds on data, and we must feed it. It won't find the data unless we let it there. And to feed it on data, we need to understand what data it is. We're evolving, we're innovating, and definitely excellence comes and it will be here to stay.
We have to venture into artificial intelligence, and especially in diagnostics and radiology. We have to exploit platforms like telemedicine and electronic medical records. And of course, when we have an integrated electronic system, then it also caters for logistics management. And I'm glad that even in the private sector, and from the presentation, CCare is offering specialized services. I acknowledge the private sector for spearheading innovations, telemedicine, teleradiology, even telepathology. CCare is exploring this area to a great extent.
When there is economic development in a country, there are many things that follow through. And one of the essential sectors of any economy like Uganda, where 70% of the population is below 30 years, is healthcare that contribute to ensure that that economy takes off. And today, the main reason for the symposium is not to showcase what CCare is or what we have been doing, but it's a moment of reflection with all our partners to decide about what's going to come next in terms of healthcare development for the country.
We did a research recently, and our research revealed that we see around 650,000 patients in a year, and around 20 of those felt that we were expensive.
So there is a difference between cheap and affordability. Of course, cheap would affect quality, but affordability offers value. And what CCare is doing at the moment is to focus on those models that target super specialists like oncology, neurosurgery, endoscopy, laparoscopic services, among others. The overall cost of these services goes down because now you reduce outward medical tourism that comes with additional expenses to the patient and to the family.
Anybody trying to invest in healthcare needs to know that it takes a long time to make the money. However, you just need to do the things that are sustainable. If you are dealing with basics, especially in our country where we know that some of the things that are no longer basics in developed countries are still basic in our country, I don't think that a player like us deserve to make sophisticated financial models in order to invest.
Good healthcare costs money, it's not cheap. But we have to be at a place where we are making sure that we improve our efficiency to make sure that we can be able to deliver these good services at an affordable price, and also make sure that we can have this done for the long term. So what's very critical here is that for you to achieve good clinical excellence, then you need to invest in the people, the doctors, the nurses, to be able to get the right competencies, the right skills that can be able to utilize the new technology that you're bringing into place.